Screen to Save, NCI Colorectal Cancer Outreach and Screening Initiative. Screen to Save, Colorectal Cancer Basics. Colorectal cancer, incidence, risk factors, and prevention. What is colorectal cancer? The colon is the large intestine. The rectum connects the colon to the anus and holds waste until it's eliminated from the body. Cancer that begins in the colon or rectum is called colorectal cancer, CRC. Colorectal cancer is the second leading cause of cancer death in the United States. Approximately 135,000 people are diagnosed with colorectal cancer annually. About 50,000 people die from colorectal cancer. How does colorectal cancer develop? Colorectal cancer usually begins with a small growth or polyp in the lining of the colon or the rectum. Over time, these polyps can develop into cancer. Many people with polyps or colorectal cancer do not experience any symptoms. Those who do experience symptoms may have stomach pain, aches, cramps that won't go away, blood in the stool, a feeling that your bowel does not empty all the way, changes in the bowel habits or consistency of stools, feeling or being very tired or weak, unexplained weight loss. What are some of the risk factors? The risk of colorectal cancer increases with age. Colorectal cancer is the most common among adults age 50 and older, and those with a personal or family history of colorectal cancer or polyps. History of inflammatory bowel disease, such as Crohn's or ulcerative colitis, increase your risk. Several lifestyle factors increase risk. Lack of regular physical activity, diet low in fruits and vegetables, low fiber, high fat diet, being overweight or obese, alcohol consumption, tobacco use. Is Lynch syndrome a risk factor? Another risk factor is the genetic condition known as non-polyposis colorectal cancer or Lynch syndrome. Lynch syndrome is hereditary and caused by inherited genes, changes that could be passed from parents to children. Those with Lynch syndrome are more likely to develop colorectal cancer. Your doctor may recommend genetic testing or counseling if you were diagnosed with colorectal cancer in the past or have family history of colorectal cancer or Lynch syndrome. About 3% or 1 in 30 of colorectal cases are due to Lynch syndrome. Is colorectal cancer preventable? Cancer prevention is taking action to lower your risk of cancer. Cancer screening can help find cancer before you have symptoms. Colorectal cancer screening helps decrease chances of dying from the disease. Screening can find the disease early. Polyps can be removed before they turn into cancer. Lifestyle changes can decrease your colorectal cancer risk. Diet high in fruit and vegetables, regular physical activity, no smoking, and limited tobacco use. Colorectal cancer screening recommendations and options. Who should be screened and how? Colorectal cancer screening should begin at 50 years old and continue until you are 75 years old. 2 tests can be used for colorectal cancer screening. Fecal occult blood test, or FOBT, or fecal immune test, FIT or IFOBT, our home screen test, and then colonoscopies. At-home screening. The fecal or blood test or the fecal immunological test are used to check for stools and other variants. At-home screening, FOBT, fecal occult blood test, used to check stool for blood that can only be seen with a microscope. Small samples of the stools are placed on special cards. Cards are returned to the doctor or laboratory for testing. Should be done yearly. Fecal immunochemical test, also to check stool for blood. Samples of the stool are placed in a small vial. The vial is returned to the doctor or laboratory for testing. Should be done annually. Screening by a medical profession, colonoscopy. Colonoscopy is a procedure to look inside the rectum and the whole colon. A colonoscope is a thin tube-like instrument with a light and lens for viewing inside the colon. A colonoscope may also have a tool to remove polyps. Colonoscopies should be done every 10 years.